What's something people don't know about the 2024 Mpox outbreak? Let's dive in. The 2024 Mpox outbreak has taken the world by surprise, and there are many facets to this crisis that the general public may not be aware of. From its origins to its rapid spread and the measures being taken to combat it, there's a lot to unpack. So let's delve deeper into the details of this outbreak and understand what makes it so concerning. Mpox, formerly known as Monkeypox, is making headlines again with a new, more severe strain spreading across continents. This strain has shown a higher transmission rate and more severe symptoms compared to previous outbreaks. The virus has mutated, making it more resilient and harder to contain. This has led to widespread panic and a rush to develop more effective treatments and vaccines. Originating in Central Africa, this variant has led to a surge in cases and deaths. The region has been particularly hard hit, with healthcare systems struggling to cope with the influx of patients. The virus has spread rapidly through communities, exacerbated by factors such as limited access to healthcare, poor sanitation, and high population density. Efforts are being made to provide support and resources to these areas, but the situation remains dire. The World Health Organization has declared it a global health emergency. This declaration has mobilized international efforts to contain the outbreak and prevent further spread. Countries around the world are coordinating their responses, sharing information, and providing aid to affected regions. The WHO is also working on updating guidelines and recommendations to help manage the crisis more effectively. But what does this mean for the US? The United States, like many other countries, is on high alert. While no cases of this new strain have been reported in the US so far, the potential for it to arrive is a significant concern. The government and health agencies are closely monitoring the situation and preparing for any eventualities. So far, no cases of this new strain have been reported here. However, this does not mean that the country is safe. The virus could be introduced through international travel or other means, and the healthcare system must be ready to respond quickly and effectively. Hospitals are preparing for the possibility of an outbreak, ensuring that they have the necessary resources and protocols in place. However, health officials are on high alert and preparing for its potential arrival. The Centers for Disease Control and Prevention, CDC, is working closely with other health organizations to track the virus and develop strategies to prevent its spread. This includes stockpiling medical supplies, training healthcare workers, and conducting public awareness campaigns to educate people about the virus and how to protect themselves. Mpox belongs to the same family as smallpox but is unrelated to chickenpox. This family of viruses, known as orthopox viruses, includes some of the most dangerous pathogens known to humans. While smallpox was eradicated in the late 20th century, Mpox remains a threat due to its ability to jump from animals to humans and its potential for human-to-human transmission. It's a zoonotic disease, meaning it can spread from animals to humans and from human to human. The initial transmission often occurs through contact with infected animals, such as rodents or primates. Once the virus has made the jump to humans, it can spread through close contact, making it difficult to control in densely populated areas. The virus spreads through close contact, including skin-to-skin contact and respiratory droplets. This means that activities such as shaking hands, hugging, or even being in close proximity to an infected person can lead to transmission. The virus can also survive on surfaces for a period of time, making it possible to contract it by touching contaminated objects. Symptoms of Mpox include fever, rash, and swollen lymph nodes. The rash typically starts on the face and then spreads to other parts of the body, including the palms of the hands and soles of the feet. The rash goes through several stages, from flat lesions to raised bumps, and eventually forms scabs that fall off. Other symptoms can include muscle aches, headache, and fatigue. While it can be severe, treatments and vaccines are available. Antiviral medications can help reduce the severity of the symptoms and shorten the duration of the illness. Vaccines developed for smallpox have been shown to be effective against Mpox, and efforts are underway to produce and distribute these vaccines to at-risk populations. Staying informed and following health guidelines is key. Public health agencies are providing regular updates and recommendations to help people protect themselves and their communities. This includes practicing good hygiene, avoiding close contact with sick individuals, and seeking medical attention if you develop symptoms. By staying informed and taking appropriate precautions, we can help slow the spread of the virus and protect those who are most vulnerable. This is the latest on the 2024 Mpox outbreak. As the situation continues to evolve, it is crucial to stay updated with reliable information from trusted sources. The global community must work together to address this crisis and prevent further spread. Stay safe, stay informed, and take care of each other.